Have you ever tried to lose weight without stepping on a scale? Or improve your golf game without keeping score? Or drive your car with no speedometer, no gas gauge, and no warning lights? Of course not. So here's my question. Why are so many people trying to improve their brain without ever measuring how it's functioning? Hi everyone, I'm Dr. Bill Ray DC, DAACS, and welcome back to Fix My Brain Today, the channel where we explain how your brain works so you can improve your memory, focus, mood, sleep, and overall quality of life. If you're interested in keeping your brain healthy as you age, improving your thinking, or helping someone you love who may be experiencing memory problems, this video is for you. Why measuring your brain matters. Imagine trying to improve your golf swing without ever watching a video of yourself, or trying to lose weight without ever stepping on a scale, or driving across the country with no dashboard, no speedometer, and no fuel gauge. You would be guessing. The same idea applies to your brain. Many people wait until they notice memory problems, difficulty concentrating, anxiety, poor sleep, or changes in mood before they think about brain health. Even then, many rely only on how they feel from day to day. While your symptoms are important, they tell only part of the story. Whenever possible, measuring brain function provides valuable information that can help you and your healthcare provider make better decisions. Think of it this way. A cardiologist measures your heart, an endocrinologist measures your blood sugar, an orthopedist measures bone density, your eye doctor measures your vision. It also makes sense to measure how your brain is functioning. The goal is not simply to find problems. The goal is to establish a starting point, monitor changes over time, and determine whether your brain is responding to healthy lifestyle changes or treatment. This is one of the most important principles in healthcare. You can't effectively manage what you don't measure. Why measurements matter? The brain is incredibly complex. It controls your memory, attention, emotions, balance, movement, decision-making, sleep, and nearly every function in your body. When something changes, it is often helpful to answer questions such as, is my brain getting enough oxygen and blood flow? Are certain areas working harder than others? Is my nervous system constantly stuck in fight or flight mode? Am I improving over time? Are the therapies I'm using actually helping? Without measurements, these questions often become educated guesses. With measurements, your healthcare provider can better understand your unique brain function and develop a more personalized plan. Think of brain testing like a dashboard. Your car's dashboard provides information before major problems occur. Your speed, fuel level, engine temperature, tire pressure, warning lights. None of these measurements repair the car. They simply tell you what's happening so you can make better decisions before small problems become large ones. Brain assessments work much the same way. They do not replace a complete medical evaluation or diagnose every condition by themselves. Instead, they provide valuable information that can be combined with your medical history, physical examination, imaging studies, laboratory tests, and cognitive evaluations to create a more complete picture of your brain health. Professional assessment tools you may encounter. As you continue learning about brain health, you and your caregiver may hear healthcare providers, especially those practicing functional neurology, integrative medicine, rehabilitation, or brain performance care, talk about specialized assessment tools. These tests are optional and are generally performed only in professional healthcare settings. You do not need any of these tests to benefit from the information in this book, but understanding what they measure can help you become a more informed patient. Quantitative electroencephalography, QEEG. QEEG, often called brain mapping, measures the brain's electrical activity. Small sensors are placed comfortably on your scalp to record the tiny electrical signals produced by millions of brain cells communicating with one another. The information is then compared with large databases of people in similar age groups to identify patterns that may suggest certain brain regions are working differently than expected. Some providers use QEEG to evaluate attention and concentration, brainwave balance, sleep-related patterns, recovery after concussion, stress-related changes, overall brain function. QEEG does not read your thoughts or measure intelligence. Instead, it provides another piece of information that may help guide care when interpreted by a qualified professional. Functional near-infrared spectroscopy, FNIRS. Your brain requires a constant supply of oxygen-rich blood. FNIRS is a painless technology that shines harmless near-infrared light through the scalp to measure changes in blood oxygen levels in the outer parts of the brain, while you perform simple mental tasks. This allows healthcare providers to observe how different brain regions respond during activities involving memory, attention, problem-solving, decision-making, mental flexibility. Think of it as watching which areas of the brain turn up their activity while you perform a task. Because healthy brain function depends on healthy blood flow, these measurements may provide useful information about how efficiently certain brain regions are working. Heart rate variability, HRV. Although HRV measures your heart, it also provides important information about your brain and nervous system. Heart rate variability looks at the tiny differences in time between one heartbeat and the next. A healthy nervous system naturally speeds up and slows down the heart from moment to moment. Generally speaking, higher HRV often reflects better adaptability and recovery. Lower HRV may be associated with stress, illness, fatigue, poor sleep, or reduced resilience. Since the brain controls much of the autonomic nervous system, HRV offers a useful window into how well the brain is regulating stress and recovery. Many providers use HRV to monitor progress during programs focused on stress reduction, sleep improvement, exercise, breathing training, meditation, brain wellness, neurofeedback. Neurofeedback is different from the other assessments because it is primarily a training method rather than a diagnostic test. During a neurofeedback session, sensors monitor your brainwave activity while a computer provides immediate visual or auditory feedback. As your brain produces desired patterns, the computer rewards those changes through the feedback you receive. Over multiple sessions, some people learn to improve focus, attention, relaxation, emotional regulation, mental performance. You can think of neurofeedback as physical therapy for certain aspects of brain function. Just as muscles become stronger through repeated exercise, some people may improve specific brain functions through repeated practice with feedback. No single test tells the entire story. One of the most important things to remember is that no single brain test can explain everything about your brain health. Just as your doctor would never diagnose heart disease using only one blood pressure reading, brain health should never be judged by one measurement alone. Good healthcare combines many pieces of information, including your medical history, your symptoms, physical and neurological examinations, cognitive testing, laboratory testing, brain imaging when appropriate, functional brain assessments, and your progress over time. Together, these pieces create a more complete understanding of how your brain is functioning. A note for patients and caregivers. If you are caring for a spouse, parent, family member, or friend, remember that changes in memory, attention, mood, or behavior may develop gradually. Objective measurements can sometimes reveal patterns that are difficult to notice in everyday life. They can also help track whether a person's condition is improving, remaining stable, or changing over time. This information may help families make more informed healthcare decisions together. A final thought. Technology continues to improve our ability to understand the human brain. While no assessment is perfect, thoughtful measurements can provide valuable information when interpreted by trained professionals and combined with good clinical judgment. These tools should never replace a conversation with your healthcare provider, but they can become important pieces of the larger puzzle. The purpose of measuring the brain is not to label people or predict the future. It is to better understand how your brain is functioning today, so that you can make informed choices to help protect, support, and optimize your brain health for years to come. Remember, the better you measure your brain, the better you can manage your brain. Here's the big takeaway. The goal isn't simply to find problems. The goal is to understand how your brain is functioning today, so you can make smarter decisions to protect it tomorrow. Remember, the better you measure your brain, the better you can manage your brain. If you enjoyed today's video, please give it a thumbs up, subscribe to the channel, and click the notification bell so you never miss another episode. For more practical brain health education, visit fixmybraintoday.com, where you'll find books, educational resources, and tools designed to help you better understand your amazing brain. You'll also discover my growing Fix My Brain book series, covering topics like memory, sleep, anxiety, focus, healthy aging, and many of the brain challenges people face every day. I'm Dr. Bill Ray, DC, DACS, and thank you for spending part of your day with me. Until next time, keep learning, keep growing, and remember, when you understand your brain, you can change your life. See you in the next video.